Hello, good evening. It's Dr. Chudi Ufundu, and it's our weekend of, when I mean weekend, it's our first time touching base after the weekend. Now, today it's a good day, and today's clinic is going to focus on facts about fertility. So, because we are counting down to the ending of 2022, I want us to have a quick review about fertility. So, what are the important facts about female fertility, male fertility? What are the things you need to have in your fingertips so you can make better and informed decisions? Thank you so much. My name is Dr. Chudi Ufundu. I'm the convener of this group, Snowspirations Global Health Solutions, and I plan to spend about 30 minutes discussing this topic. Now, remember that every Tuesdays, 6:30 p.m. Eastern Time, US. Now, it's going to be also, I think it's going to be, if I'm correct, it's going to be 12:30 p.m. in Nigeria because we fell back and kind of equilibrated with Nigeria. So, unfortunately, it's going to be late for you if you're in Nigeria, but it is what it is. We're just sharing knowledge. And this is about the best time on Tuesday we can get the knowledge. So, this evening, we're going to talk about the facts about female fertility, about male fertility. COO is already in the clinic. I think one other person joined. If you wouldn't mind, let's know who you are. My name is Dr. Chudi Ufundu. I love teaching. I love telling everybody about fertility. I love reminding you that you can become a mother, you can become a father. I love reminding you that by this time in 2023, you will actually succeed in becoming a father, in becoming a mother. Nothing is impossible in our group. So please, when you join, let's know who you are. Just tell us your name and where you're located, and we're going to start. I'm going to keep it very simple because the simpler we keep things, the better. And this will be my reference point when I talk about the female part. This is the female reproductive system, the internal female reproductive system. Immediately after this clinic, we're going to have another clinic in Facebook. So if you can't catch up with us in YouTube, make sure you catch up with us in Facebook. It's going to be about 30 minutes. Now, let's start. So you see, the female reproductive system is amazing. Every singular girl child comes into this world with this beautiful organ, beautiful system, comprising of the vagina, the cervix, the womb, the tubes, the ovaries, and inside the ovaries, the eggs. Now, number one fertility fact, which everyone should be excited about, you were actually born a mother. You were actually born a father. Now, for the women, their own pattern is entirely different from the men. Men reproduce based on quantity. The male reproductive system is very wasteful because every 3 months you replenish your sperm. Every ejaculation during lovemaking episode, a man will ejaculate healthy quality sperm in the millions. However, the woman is different. Once you're of age, so what do I mean by being of age? Once a girl child starts developing secondary sexual characteristic, breast, pubic hairs, and she starts bleeding, she can become pregnant. Now, lately, it can happen as early as 6, 7, 8, 9. So, if you pay attention to your girls, you will see that they are developing faster. It's just the time we are living in. Now, at that point, they start bleeding. Every single month, they will release one egg. Now, so you can see the difference between the male and the female. Men, wasteful per ejaculate, wasteful in millions. For a woman, just one egg, one opportunity in a month to become pregnant. Now, by the time you keep doing all this, by the time you get to your mid 20s, for a healthy female, your best fertility time is in your mid 20s. So if you happen to be lucky or blessed or favored and you meet your male partner who loves you guys have enough money, you guys have enough resources, and you guys want to start your family, guess what? The best time, the best period in your entire reproductive life, you can easily have a baby. You blink, you will have a baby is in your 20s, your mid 20s. Now, as you are getting older, age begins to affect your fertility, especially women. Age can affect men and also affect women, but mainly the women. So by the time you have your peak in your fertility, that means you can easily become pregnant when you're 25. You can easily become pregnant when you're 26, 27. Now, by the time you're getting to 27, by the time you're kind of trying to get to 28, your fertility kind of begins to dwindle. By the time you get to 35, as a woman, you are already classified as advancing maternal age. So you can see that a woman is programmed. There are certain things you must do at certain times. Now, I'm not saying this so that you go and encourage your girls to start marrying early. No. Maturity is important. Balance is important. Getting enough resources to raise your family is important. So it's only matured adults that should have kids. But I'm telling you what's obtainable naturally. So by the time you now get to 37, you will notice a very sharp decline. If we plot the graph, you notice that at age 37, your fertility is nosediving. Now, the essence of what I'm telling you today is to know where you stand. You see, it doesn't necessarily matter when you meet your partner. You can meet your partner at age 50 as a woman, and you can be a mother next year. What you need to apply at that age 50 is what you need to do to become a mother. Some people can have excessive number of years, but they're not doing the right things, and they begin to have problems. A woman can easily meet her partner, and she can become pregnant immediately, and she can have a baby immediately because she has the right knowledge. So for a healthy woman who is still ovulating, remember the key word is still ovulating. So long as you have not gone into menopause, possibility you are ovulating is very high. Ovulation simply means so long as that the egg that God gave you as a baby girl, you are releasing them every month. That's called ovulation. Ovulation is the process of releasing your egg. So long as you are ovulating, it's confirmed that maybe that your regular 28-day cycle is an ovulating cycle. Unfortunately, some women might be bleeding, but they are not ovulating. So the fact you're bleeding is not categorically a confirmation that you're ovulating. But in an ovulatory cycle, and you are healthy, so assumption is that your BMI is good, you don't have hormone imbalance, you don't have any stress, you don't have any other medical problems. If you are entirely healthy, you're eating good food, you're not binging on alcohol, you're not smoking, it's expected that you are actually having 7 days every month when you have the best time to become pregnant. It's called your fertility window. Within these 7 days is the period that if everything else works in your favor, you can have pregnancy staring at you. Now, because people are wired differently, as you expose yourself to the environment, your chances will be affected by the environment and you will also affect the environment. But by standard, if you were to put a woman in a perfect place, it's expected that 5 days before your ovulation, your window opens. So within that 5 days, if you meet with your partner and there is a presence of the sperm, you can get pregnant. So a woman can get pregnant 5 days before her ovulation, then a day after. This is the so-called fertility window. This is the best time you have in your cycle to become pregnant. But this is what we know. Because there are so many things that can affect your regularity, things like your mood, your exercise, your food, and all that, they can flip your cycle. So we don't necessarily need to make it like practical. It's just for academic purposes to know your body, study your body, and know the trends. So what we generally preach in our group is, regardless of if you think you are ovulating or if you're in your fertile window, it doesn't matter. What we preach is 48 hourly lovemaking. That's about 1 day at a time, one every other day. So skip 1 day, continue the following day. This is what we preach in this group. Now, another fact which will help you to have kind of a little comfort, about 80 to 90% of couples that actually, stay together and, make love regularly, about 80 to 90% within 1 year will become pregnant. So what's that telling you? Pregnancy doesn't happen overnight. Sometimes everything will be perfect, but you will not become pregnant immediately. But within a period of 1 year, it's expected you become pregnant. 80 to 90%, that's a huge number. Now, we also know generally, unfortunately, from a global kind of perspective, that 1 in 6 couples are currently having problems becoming pregnant. That's a lot of numbers. Now, this might be due to knowledge. This might be due to approach. This might be due to attitude. This might be due to your practice. This might be due to your perception. So there are so many factors that might be affecting your ability to become pregnant. Now, based on where I live, which is in America, 12% of women aged 15 to 44 are currently having difficulties having a baby. Very tough. Now, what you eat every day can affect your fertility, either in a negative way or a positive way. What you do every day regarding your physical activity can also affect your fertility, either in a negative way or a positive way. So you are the totality of what you do every day. And if you do the right things, you will easily become pregnant. But even when you become pregnant and you flip from doing the right things to be doing the wrong things, you can put that pregnancy in danger because the woman is well structured to perform in a particular way. I'm talking especially about women. Men, for some reason, I don't know why God gave men some pass. There are so many men that will be doing all the wrong things and they will still go ahead and be having babies. There are so many men that have been smoking for the rest of their life, but they will still go about having babies. There are so many men that don't drink water, they only drink alcohol, they still go about having babies. But you can't try that as a woman. I'm not giving a pass to men, but I'm just telling you that for some reasons, men generally have a kind of a leeway to wiggle out. But remember, as a woman, once you get to 30, you should be in the front seat because any moment from now, your fertility starts dwindling. So what I mean by your fertility is dwindling. Your numbers are reducing. The quantity of the eggs you have are reducing. Now, out of that quantity that is reducing, the quality is even reducing. So double issue, quantity and quality, which can freak you out. So it's left for you to know what to do so you can activate your natural potentials that God already gave you. Okay? So that's my presentation. I'm going to quickly allow us to start asking questions. I can see Amara Ugudike. Thank you for coming. Tosi, regular Tosi, thank you so much. Admin, I don't know who this person is. It looks like someone is trying to spam our group. So disregard this person saying, find love in your city. It's probably a scam. But right now, please ask me any question regarding your fertility. Ask me any question. We're going to spend about 15 minutes, possibly. So the clinic is open now. Please start asking your question. You see, the fewer the merrier. So the fewer people you have in the clinic, the better. So feel free to ask me any question. Amara, COO, Tosi, it's your clinic. Feel free and let's interact. Okay, now remember, we've announced the topic for November. SGHS Fertility Summit. SGHS Male and Female Fertility Summit Super Masterclass, whichever one you prefer to call it. But keep a day with us on the 27th. You do not want to miss this class for anything because this class is going to be a springboard that will launch you into, at least worst case scenario, becoming pregnant by 31st December. This is our goal, to make sure we aid every woman in our community who wants to be a mother to at least become pregnant by 31st of December 2022. The clinic is going to open now. Please feel free to ask your questions. Don't be shy. Don't be ashamed. Just ask me any question. I'll give you my feedback. Then you go home and see what you can do to correct whatever you're not doing correctly. Everybody is welcome to ask their questions. Okay? Do we have any? And coincidentally and ironically, the people that attend the clinic are not people that necessarily have infertility problems. The regulars, my COO, Tosi. Tosi is not currently looking for a baby. I don't know if the COO is planning to have another. I don't know. Maybe she is. I don't know. But we'll see. So please ask your questions. Let's go. Okay. What are the most lifestyle changes? Okay. What are the most lifestyle changes should make? So guess what? Everything you do every day has to be from a positive perspective. So starting with what you do when you wake up in the morning, you thank God. You say, God, I thank you. God, I thank you because I have a glass. God, I thank you because I have water in my glass. God, I don't care if it's half full or half empty. I have glass. I have water. And God, I know you're the source of my water and you're going to sustain all my needs. When you say such prayer, you go into your day. The first person you see in the day is going to tell you negative news. The first page you open in social media is going to tell you negative news, but you'll be in charge of your mind. Now, when you go out there, before you take your breakfast, think about what you eat. So every single thing you do every day needs to be modified, starting from what you eat. When you want to eat your breakfast in the morning, you make sure you select the options from the 5 classes of food: fruits, vegetable, water, good protein, whole grains, good fats. Then drink a lot of water. Then when you go out there and you have an opportunity to binge on alcohol, you don't even drink at all because you don't need it. Then you put in your 30 minutes exercise every day and you keep going. Then by the time you're done in the day, you shower, you interact with your partner, then you sleep. Sleep is very important. So these are very simple little quick fix. Of course, you take your prenatal multivitamins. You can either take it in the morning, you can take it in the afternoon, you can take it in the evening. It doesn't matter when you take it. But the most important thing is that you're taking it. When you do all these little simple things, they are the big things that will eventually help you. So your lifestyle modification is not like you wake up and you start going crazy. No, little simple steps. A drop of water can rain. So those are the things you need to do. Very, very important. Okay? All right. Exactly. Never say never. Children are blessings. So if I see COO pregnant with a protruding belly tomorrow, I won't be surprised because she's someone that loves to practicalize everything she learns. So I don't know what she's up to. If we see it is a blessing. After all, a baby is a baby, right? Now I don't know if it's gonna be a grandmother or her kids having babies. I don't know, but if we see baby, we're gonna take babies. Celery juice is okay. Anything from family of fruits and juice, that's pretty good. You can drink your juice. But guess what? Sometimes you just need to drink your water. You see, this is a truth. Most of all those things we consume in the name of juice, we don't know how they were preserved. Sometimes they use a lot of preservative, they use a lot of additives. So if you really want to enjoy your juice, go and juice it yourself. Get your fruits, get your oranges, and buy some juicer, and you drink raw juice from your own produce. It's better than some of these things we buy from, places we don't even know how it was prepared. Okay? So COO, we are waiting for your babies. Remember, I said babies. You have to lead by example. After all, you're the COO. Guys, keep asking your questions. Where is Tosi? Tosi, you don't have any questions? You can ask on behalf of your friends. So it's not a must you ask about yourself. And some people will come and say, "There is this my friend, and this and that." Meanwhile, she's asking about herself. So feel free and let's interact before we go to Facebook. Okay? It's pretty straightforward, topic that everyone should be conversant with. No ambiguity, but you just need to understand that your age is the most important gift. When you use your age positively before you blink your done. Yeah, if you just see yourself, that's pretty good. Very, very good. Can you speak briefly on typical female fertility test? Amazing question from Kenneth. So there are standard fertility tests that every singular woman, whether you're having infertility or not, if you want to have a baby, we need to know what's going on. Number one, your hormonal assay. When we are looking at your hormones, we are looking at the reproductive hormones, the key reproductive hormones, starting with estrogen, progesterone, follicular stimulating hormone, luteinizing hormone, anti-Mullerian hormone. Of all the hormones I mentioned, the most important one is AMH. Anti-Mullerian hormone level will tell us about your ovarian reserve. How many eggs do you still have in your ovaries? Now, your estrogen is very important because the reason why you're a woman as I'm talking to you right now is because of your estrogen. Your progesterone is very important because eventually when you become pregnant, if you don't have adequate level of progesterone, you're going to miscarry that baby. Your follicular stimulating hormone is very important because it's the hormone that will signal the follicles to start developing into dominant follicles. Your LH hormone, luteinizing hormone, it's what we call in my language otimpo. So otimpo means is the hormone that will tell the whole body, hey, guys, get ready, the queen is coming. So your LH hormone is what will announce that the egg is about to come. That's what you check in your ovulation test kit. Then we think about the prolactin. Prolactin is what will tell your breast, hey, stop doing shakara with that breast. It's time to produce milk that will breastfeed the baby. These are standard hormones you can't mess with. Then we go into the womb. We take a look at the womb through normal ultrasound. Then we look at your tubes. Hysterosalpingogram, HSG, very important. Now, most times, we also look at a couple of other things which screen you for chlamydia or gonorrhea because those two can affect your ability to become pregnant because it damages your tubes. So pretty much straightforward, looking at stuff. Now, when we're doing your hormonal assay, there are specific days we have to run them. There are some hormones you have to do on day 2, day 3, day 4, day 5. Then there is a specific hormone we have to do on a particular day 21, which will tell us if you're ovulating. Now, we also go to your partner. It's not only the women. We go to the man. We check the man's body weight. Then definitely for women, we need to check your body weight. We need to make sure that your BMI is very, very good within the normal range, 18.5 to 24.9. Now for the man, we look at your sperm. We do what we call seminal fluid analysis. We look at the quantity, we look at the color, we look at the count, we look at the motility, we look at the morphology. If you're good, then you're good. So these are the standard tests that anybody having any problem anytime should go for. When you go for this test, it will help to guide us towards what will work better for you. Let me give you an example. If you want to be a mother and you're currently 50, can you be a mother? Why not? Can you be a mother naturally? Yes. Are the chances reduced? Yes. What would be the best option for you to become a mother? It depends on your anti-malarial hormone. It depends on if you still have eggs. If you still have eggs, the possibility is there, though the window is narrowing. But the best way to become a mother, if you're 50, is to yield and go for IVF with donor eggs. So these are the things you should know. You don't just wake up and say, oh, I want to have a baby. Then you start running all over the place. Start spending the little money you don't have. Going to the places you don't need. Running some tests you don't need. They will also put a lot of anxiety. They will see stuff. They will still candida. And they will tell you, oh, the reason why you don't have a baby is because of stuff, because of candida. The reason why you don't have a baby is because after making love, the sperm will be escaping from your vagina. That's not true. The things they tell you, they are not the reason why you don't have a baby. Everybody struggles at some point. So you need to know all these tests, because once you have them, it will be the baseline. So if you're coming to our group, you're living in Nigeria, you want us to be your doctors, you want us to review your case, then you have all these tests. What's the first thing we will do? We ask you a lot of questions, then we look at your test. We find your chances. We look for where the problems are. Then we refer you. Once we refer you, you have started your journey towards becoming a mother and a father. This is the right way to practice medicine. Good evening, Doc. Please, what's the meaning of vaginismus? Here we go. Look at this lady. It's okay. All the topics are good. Now, I'm going to explain it, okay? Now, you see, the act of love making, it's something beautiful. The best gift God gave human is to make sure that in as much as bringing forth your baby into this world will be painful, before you begin to make that baby, it's very, very, very sweet. So right, starting from the Garden of Eden, before we develop all these problems we have based on Adam and Eve, right? They are the cause of the problems we have in the world. Without Adam and Eve, you wouldn't even know you're pregnant. You wouldn't even know when you have a baby. So vaginismus simply means, for some reason, it can be what we call idiopathic. Sometimes we don't know, but a woman's body, it's in reverse mode. Anything related to making love or anything related to having intimacy is completely not wired correctly. So your vagina is in a reverse mode. It's not ready. It doesn't want to have anything. So it's not producing fluid. You don't have libido, and it's kind of in a contracted mode. So it can be anxiety. It can be abuse, someone that was abused growing up, someone that have different orientation, and someone that is generally fearful. So your vagina will just not participate in the act of lovemaking. And when that happens, it would be very, very difficult for the penis to penetrate. Some women can have what we call superficial vaginismus or deep vaginismus. There are some women that have problems in this world. There are some women that their partner's penis cannot enter inside at all, because the whole of the vagina will be contracted, will seal up. Now, this is also the theory. In some places, they will say, oh, the man entered and the woman locked him up and he can't come out again. That's called vaginismus. That's part of vaginismus. So it's actually it can be psychological, it can be medical, it can be idiopathic. Idiopathic means we don't really know why that is happening. So it can happen because of so many things. It can be a sign of post-traumatic stress syndrome. It can be due to abuse. You were raped, you were abused growing up. So you now see men like evil. So you lock up your body. Now you can get help. You need a lot of counseling. You need a lot of therapy to overcome. Because if you want to start your family, lovemaking is somewhere there waiting for you. I love that question. You see, it looks like this other lady is planning to become a medical doctor. This Tosi lady, I don't understand her again. Are there some symptoms that suggest a man may have infertility? Yeah, there is so. Number one, when a man begins to look like a woman, hmm, you begin to grow breast, you begin to add a lot of body weight, you begin to get easily tired. Previously, you can make love from today to kilo day. You're no longer interested. You're not sleeping properly. You're easily angered. And of course, when we check your semen analysis, it's very poor. So yes, these are signs you might actually have infertility. And ultimately, you can't father a child. So you'll be with your partner and you guys still don't have a baby. That's the actual evidence base that you have infertility. But it can be from the physical, it can be internalized. You know, some of you can even have erectile dysfunction because of problems with the testosterone, because testosterone is the sex hormone, is the sexual hormone that wants the woman to make love and wants the man to make love. It's mainly seen more in men. So once a man's testosterone drops, that's why they run up and down looking for sex enhancers, because naturally their testosterone is low. So anything you do every day, either good or bad, can affect your ability to have a baby. So there are some men that drink alcohol like water. Of course, you're going to have problems. You're going to add a lot of body weight. Your belly is going to get big. You won't have stamina. You're always complaining. You will be snoring. You won't be present because your body is not settled. So everything you do every day as a man adds to your fertility. Okay? Exactly. We don't hear much about male infertility. Is it uncommon? No. It's 50-50. It's 50-50 in every family right now. If we examine the man and the woman truthfully, you will discover that 50% might be coming from the man and 50% might be coming from the woman. It's just societal, cultural, institutionalized, blame it on women on everything. There are so many families, as I'm talking to you today, the reason why they don't have a baby is actually the man. But I have made it so much to be like, is the woman, this woman, give me a baby, give me a baby. So it's actually 50-50. Is equal ratio. It's very, very common. That's why when you're having infertility, we want to check the man too. Your partner must submit his sperm. And you submit your sperm the right way. There are some men, oh, in my religion, I can't do that. You have to do it. Oh. When you go to the hospital, don't you submit your sperm? Sorry, your urine and your blood? Sometimes they ask you for number 2. Have you not submitted your number 2 before? Have you not submitted your urine? Do we not take your blood? So when we tell you to bring your sperm through masturbation, you say it's against my religion. Hey, you don't want to start your family. If you don't have a problem, we will not be asking you to masturbate. So there are certain things you need to do to get your family started. So it's common, no? Very, very common. It will surprise you that majority of the families are having male factor problem. There are some women that can easily become pregnant if they apply Okafor's law. Can anybody tell me what Okafor's law mean? Can I don't answer? Of course, you know the answer. I think Tosi might know. Do you understand Okafor's law? Maybe for another lecture. But guys, 2 more minutes. Then we hit our 30 minutes. If you have not asked your question, it looks like Amara just wanted to ask about juice. The juice you make by yourself is way, way, way better in all ramifications. Okay? All right, guys. Make sure you join me immediately in our Facebook page, Facebook group. We have 2 pages, our community help page, then our normal B group page, then our group. And if you're my friend in Facebook, definitely you will see me there. Okay? All right, guys. I think we've done justice to this topic, and I'm so excited. And I just want to understand how you're ready for becoming a mother and a father, because this is the year it's going to happen. You cannot afford to go to 2020. 2023 is just a celebratory year because God is amazing. God has been faithful. So leverage on what God gave you, especially the women. Understand that your time is narrow. So start doing the right things. You're driving to work, okay? Please be careful. If you're driving, don't watch video, please. Please, that's not safe. If you're driving, get to your work. You can always review the video much later, okay? All right, guys. I'll see you guys in Facebook immediately. Until I see you, God bless you and bye-bye for now.